I'm Debbie, a respiratory nurse specialist at Asthma and Lung UK. If you're worried your child might have asthma, but you're not sure whether to talk to your doctor about it, here are the things to look out for. There are 4 main symptoms of asthma: coughing, wheezing, chest tightness, and breathlessness. A combination of these symptoms makes asthma more likely. Children get coughs all the time, so how do you know if it could be asthma? When your child coughs is a sign. Children with asthma often cough at night, in the early morning, after exercise, or when they're excited or laughing. Another sign is if your child has had a cough for a long time and it won't go away. A wheeze is a whistling sound in your child's chest, usually when they breathe out. A wheeze is not the same as other chesty noises and is often hard to hear. Even your nurse or doctor might need to use a stethoscope. So if you can't hear a wheeze but your child has other symptoms, I'd still recommend talking to your doctor about asthma. Chest tightness is another sign. This one's not so easy to notice. In my experience, children with chest tightness often rub their tummy or chest. If they can talk, they might say things like, "I have a tummy ache," or "my chest hurts." Breathlessness is another symptom to look out for. It's normal for children to get a bit breathless when they're running around and playing. So how do you know if it's something to worry about? Firstly, you might notice that their breathing is faster, or that they have to try a bit harder to breathe. You may be able to see more of their body moving, for example, moving their shoulders up and down. When they're playing, you might notice they get more out of breath or stay out of breath for longer than other children, or that symptoms carry on afterwards. Sometimes they might get breathless even when they're not exercising or being active, and finally they might start avoiding exercise because they don't like the symptoms. As a parent or carer, it's easy to feel that you're worrying too much or that you'll be bothering your doctor. But I would always want to know if one of my patients was getting these symptoms. The right treatment could help your child's cough, wheeze, tight chest or breathlessness, so it's really worth getting them seen. If you have any questions about your child's symptoms, speak to your doctor, nurse or pharmacist. You can also call our helpline.